Don't touch anything, please.
This event is now live, waiting for writer to produce content.
So you're just going to look here, and remember you'll be able to scroll. You'll be able to scroll.
Hello.
And that's what you should worry about.
You tell me when.
I may move around. It's only because of my back.
Your back way.
Just gets uncomfortable in this chair when I'm sitting there for a half hour. I'm just saying, don't be distressed. Don't worry. That nothing to do with stopping or anything like that. You can get it going, whatever.
So I'm taking off the mic first. Hello, I'm Dr. Neil Schultz, and welcome to January 2013 BeautyRx Live. This is Viewer Question Week at both BeautyRx and Derm TV, and today I'm answering your questions live over streaming video. Any questions about BeautyRx skincare products or just related skincare issues? We're supposed to be the third Wednesday of the month, and as you can see, we're the fifth Wednesday of the month. So our schedule's a little altered. Hope none of you are waiting for us on the third Wednesday, but we're going to get started almost immediately answering your questions. And please keep sending your questions. They are so great, both the questions to BeautyRx Live as well as the questions to Derm TV, which then often become the subject of videos and episodes for Derm TV. If you have a question today for me, please go to BeautyRxLive.com, use the chat box, and I will get to as many questions today as I can. As you will recall, BeautyRx Skincare is a skincare that has been giving my patients more beautiful, healthier, and younger-looking skin for over a decade with patient-proven products that address the ageless issues of colors and discolorations and textural problems, as well as fine lines and wrinkles. So we're going to go to the first question for today, and this question comes from Nicholas. My eyelids have begun to droop because they form some kind of fold or bulge of fat excess skin when receding. I recently gained some weight, but I also have dry mouth, skin, and puffy eyes as a result of some medicinal side effects that won't go away. What is the cause of my drooping eyelids? And well, if anything, can anything remedy this? Currently applying topical hydrocortisone. Nicholas, drooping eyelids usually is a function either of side effect of medication or actually drooping skin, which is age-related, and I don't know. I think it says here that you're about 25 years old, so if that's the case, these are not age-related issues. These are issues which are related either to your medication or to some neurologic issues, and really are going to be better addressed with the doctor who's giving you these medications, or perhaps even seeing a neurologist. But eyelids don't usually droop at this age, and this is not a degenerative effect of sun exposure or things like that. So I wish you luck, but I think that I'm going to pass on any more, on responding any more to this, because I think it's the issue is not really a skincare issue at this point. Sally says, I know you've always recommended that we exfoliate. However, should I stop exfoliating in the winter? My skin is red and flaky from the cold. Well, obviously, if your skin is red and flaky, you have to stop exfoliating. But Sally, everybody, when the weather changes, who has been exfoliating, hits a wall when the temperature goes down, the humidity goes down, and everybody has to change their schedule and their routine, maybe sometimes even go to a lower strength product. But to answer your question directly for where you are now, if you're red and flaky, by all means stop exfoliating, do some skim milk and water compresses, and there are links on Derm TV for instructions on how to do that. Get a 1% over-the-counter hydrocortisone cream to try to reduce that inflammation. Use a moisturizer every day, particularly before you go out into the cold wind. Make sure that you're reapplying the moisturizer several times a day. Use a soap for your facial skin, which is less drying because, again, we just have to address the issue of sensitive skin. And when all of this has come back into balance, which could take 5 days, it could take a week, then you can restart your exfoliation. We don't have to cease exfoliation in the winter. You can restart, but on a modified schedule. So instead of doing it every night, maybe you'll start with once or twice a week. Instead of leaving your product on overnight, maybe you'll wash it off after a half hour. Instead of using a 10% product, maybe you use an 8% product. So it's a question of titrating and adjusting your regimen so that it's not quite as potentially irritating, given the vulnerability of your skin. When the temperature drops, the humidity drops, all of the moisture from your skin is jumping off your skin into the air, and we need to rebalance. Michelle asks, no matter how much lotion I use, my legs are always dry and itchy. Is there anything else I can use? Well, Michelle, it has to do with how do you treat your legs. Are you shaving them? Because if you're shaving them, that could contribute to dryness and itchiness. The most common cause in the Northeast at this time of the year, again, is the cold weather, the cold, dry weather. So you probably should not be using soap on your legs more than once a week, because on your legs, all you're making, even when you're active, is sweat. Sweat is salt and water, and that dissolves off in water. But when you're using soap in drier, colder weather, you're stripping the little precious oils that you have that help to lubricate your legs. And the reason I say the little precious oils is because you don't have a lot of oil glands on your legs. So you want to reduce stripping of the oil. As soon as you come out of the bath or shower, pat your legs dry, don't rub. Add a good emollient moisturizing lotion with humectants in it, and you don't have to be afraid really about clogging many pores here. So you can use heavier products. And go easy when shaving, because in this season, when you're shaving, you're really stripping the oils again with the shaving cream. So keep that in mind. And that's really the best way for the itching. There's two other things you can do. If you're at home, you can take an ice cube and run it up and down your leg when you're itching. That'll stop the itching instantly. And the second thing you can do is get a moisturizing lotion that has menthol in it. And the menthol will create a cooling sensation that will stop the itching. And the last thing is, make sure that you're not using hot water in the shower, because hot water or bath, because hot water causes an over-drying of your skin. Jocelyn asks, is there a typical age that acne starts to subside? I'm in my mid-20s and I'm still dealing with acne. Jocelyn, there is a conventional age, a typical age, 20s, but now sometimes women are in their 30s. Now, I see a lot of women with acne into their 40s. And if you want to talk about unfair, I have patients in whom pimples are meeting wrinkles, and these are women in their 40s and 50s. So normally, acne does slow down, particularly after teenage time, into your 20s. But the reason I think that we're seeing such a skewing and change of the age spectrum for acne, particularly in women, has to do with three different things. First of all, it has to do with women being subjected to different stresses today in the workforce than they were traditionally subjected to in child rearing and when they were at home. And that's not to say that raising children or maintaining a home isn't stressful, but the nature of the stresses in the workforce are different, and we know that stress causes acne. And to take that point a step further, what about all the working women who are both raising a family, having all of the traditional stresses, and they're also in the workforce? Number two has to do with air pollution, particularly in urban centers. Air pollution today is just so much worse than it used to be, and that pollution, which is microscopic, helps to clog pores and cause breakouts. And third, the third factor has to do with cosmetics, and we even give that acne a special name called acne cosmetica, and it has to do with clogging of the pores, so please make sure. If you have oily skin, if you have acne, if you have combination skin, you have oily skin at least, if not combination. And therefore, everything you put on your skin, on your facial skin, whether it's moisturizer, whether it's makeup, whether it's sunscreen, or any medicated products, or self-tanner, has to be marked either water-based or oil-free or non-comedogenic, which is a fancy scientific word meaning that it won't clog pores. So in your 20s, if you are still breaking out, I urge you, use a glycolic product on a daily basis to help reduce your breakouts, to help remove excess dead cells and clogs that are made up of dead cells and oil. One of the most valuable functions of glycolic in your 20s has to do with helping prevent and treat acne and help maintain oil and water balance in your skin. Barbara says, do you have any advice for someone who's getting Botox for the first time? Barbara, relax. That's the most important thing you can do. Botox, which may sound scary, really isn't. Botox is a very undangerous medication. Let me help put things into perspective for you. I do a lot of injectables as a cosmetic dermatologist. 15, 20 times a day I'm injecting patients with either filler materials or Botox. Or I should say botulinum toxin, since Botox, of course, is a brand name for similar products named Dysport and Myoblock. Botox is a very small molecule. You can't be allergic to it. It just doesn't cause any type of problem or reaction that doesn't go away. You see, I tell my patients that the good news and the bad news about Botox is the same. The good news is, if you don't like what it's done, the Botox is going to wear off in 3 months and it's gone. The bad news is, if you do like what it's done, it's going to wear off in 3 months, and the positive effect that it had that you like is going to be gone, and you're going to have to repeat it. I also tell first-time Botox users that it is the most addicting thing they can do in my office, and as a result of doing it once, they will become so addicted that they will give up rent money, food money, shoe money, and firstborn to keep their Botox going. So I promise you that if you're having your Botox done, presumably by a professional who's well qualified, you're going to have a positive experience. It is not painful. It takes 4 to 7 days for the effect to start, up to 10 to 14 days for full kick-in. When I said 4 to 7 days to start and to accomplish 90% of what it does, you're not going to have a problem with it. Let the doctor know it's the first time you're doing it and that you're a little bit nervous, but there's nothing to be nervous about, I promise you. And I would love to hear from you in next month's BeautyRx Live and hear from you how your experience went. So again, I'm Dr. Neil Schultz. This is January BeautyRx Live with a live streaming video. If you have a question, please go to BeautyRxLive.com and put your question into the chat box. I'll be happy to answer it. We're taking questions today not only about BeautyRx skincare products, but about related skincare issues. And don't forget that on Derm TV, because this is Viewer Question Week, we will of course be having viewer questions on Derm TV tomorrow on Thursday. I have a question from Sylvia. I watched your viewer question video and you discussed that you can't get rid of your freckles if they are true freckles. I'm in my mid-20s, have olive-colored South Asian, and I have some freckles around 20 under my eyes and around my nose. I received a lot of unprotected sun exposure in my childhood. Some of the spots have gotten darker as the years have progressed and have not lightened up. Do you think these are sun-damaged spots that could be corrected? If your spots do not change in the course of the seasons, Sylvia, if they don't lighten up in the winter, and from the way you're talking, it sounds like even at your age, that these might be sunspots as opposed to which are sun freckles, liver spots, age spots, which are easy to fix with laser treatments, and you can make them go away completely. And when the lasers treat these, they usually lasers like the YAG laser or the Alexandrite laser or the Ruby laser will get rid of them completely on the first treatment. Unfortunately, there's often some black and blue associated with that, just in the spot of the freckle. But if you have treatments with intense pulse light, there's usually no black and blue, but often it's more than one treatment, so it's more expensive. But from the way you're describing that, I'm inclined to think that these might be true sunspots rather than natural freckles, and it would be worth a visit to a dermatologist who does laser surgery to be evaluated and see if you can get rid of your freckles. Allie says, asks, for someone who can't afford laser hair removal, do you recommend shaving or waxing your legs? Allie, this is an easy one. Hands down, shaving. The problem with waxing is that many people, when they wax and they pull those hairs out, the hair strips the lining of the channel that the hair is supposed to grow through. And then when the next hair wakes up and starts to grow, it doesn't have a path. It doesn't know how to get out. So it winds up curling up inside, and you then have an ingrown hair. Not just an ingrown hair, but you get the bump, you have the discomfort, the redness, the tenderness. Eventually it pops, the hair falls out. But the next time that hair grows up, 6 months or a year later, you're going to go through the same thing. There are a lot of women who wax and don't get ingrown hairs. So I can't tell you that you'll get them for sure. But so many women who do wax do get ingrown hairs, and the problem is once you've done it, you can't go back. Because once you've stripped the follicle, and that stripping has caused the ingrown hair, you can't fix it. What you can do at that point, though, is you can have those follicles killed with a laser. Of course, there's an expense. But that is the way to stop the progression, the process that's been set in motion of repeated ingrowns. Okay. Shaving, of course, shaving is an issue of, well, it's not feminine. You may not want to take the time to do it. You have to maintain it frequently. On Derm TV, there are several episodes on shaving tips for women, where I explain how you can get a shave without getting irritated, particularly by shaving in the shower and using a shaving cream and shaving with the grain before you shave against the grain, and so on and so forth. So hands down, I'm a big fan of shaving rather than waxing when possible. Question from Max. What kind of shampoo should I use if I have an itchy scalp? I don't see any flakes like dandruff. It just itches throughout the day. Max, that's a very common problem, and what you probably have is subclinical dandruff or subclinical seborrhea. So even though you can't see the flakes, you're probably itching on the basis of inflammation in the skin, which is being caused by some form of excess oil production that's getting trapped, which is what goes on in all of dandruff, which is the same thing as seborrhea. So I would recommend that you use a medicated shampoo, which is appropriate for dandruff, even though you can't see it. And the medicated shampoos, the active ingredients that I like the best of all of the active ingredients are tars and salicylic acid. A very good over-the-counter tar shampoo by Neutrogena is T-Gel shampoo. And if you have blonde hair and don't want to use a tar shampoo, you can use a salicylic acid-based shampoo, and the same company makes a shampoo called T-Sal. And when you use these shampoos, lather up for a minute, rinse them out, lather up for another half a minute, do that every day for a week, and I bet that you'll see a significant diminution in your itching. Talia asks, I walk to work in the morning. Is there anything besides sunscreen, of course, that I should use to protect my face from the cold winter air? Talia, yes, there is, and that's a very good question. And the most important thing you can do besides sunscreen is moisturizer, because the cold, dry wind, of course, is bad for your skin, as another environmental thing, just as is the UV light from the sun. So you want to use a moisturizer in addition to a sunscreen, but let me suggest that you use a combination product, get two for the price of one. Why don't you use a moisturizing sunscreen? In BeautyRx, we have the replenishing moisture cream SPF 15, which is an SPF 15 in a moisturizing base, in a nice emollient base with good humectants. So whether you use two products or one product, you definitely need a moisturizer. And just remember, if you can use two separate products, sunscreen and moisturizer, make sure you use the sunscreen first, of course, always first, and then the moisturizer after. Teresa asks if there are any preventative treatments for the neck. That's a really interesting question. Other than sunscreen, Teresa, which will help, of course, with texture and color in terms of broken capillaries, which is redness, and the brown discoloration. Other than that, sunscreen will also help with fine lines and wrinkles. But when you talk about preventative things for the neck, I think you're talking about the vertical bands that occur, the sagging of the skin. And I know of no treatments that will prevent those, but we have more and more treatments today that will help those, from minor external treatments with lasers to invasive treatment with surgery. So don't give up. Use your sunscreen, and when you're in your 50s, maybe it'll be time to start considering some of those other procedures. Well, that's all we have time for today. This is Dr. Neil Schultz on BeautyRx Live. I want to thank you for joining us today, for sending me your great questions. Please keep sending them. Please tune in next month for BeautyRx Live again, when it will probably be on time on the third Wednesday of the month. I'm very anxious to hear what happened with our friend's first experience with Botox. Please keep sending your questions also to Derm TV, because these questions are the questions that so many of the episodes come from. Again, Dr. Neil Schultz. Have a good end of the month, and we'll see you next month.